On this Saturday night, a call for help from Canadian businesses.
We won't be able to last through June.
Will small and medium companies be able to pay the rent while shut down? The tension in the U.S. to reopen the American economy, plus privacy versus public health.
This is not a sort of behind your back, big brother sort of thing.
Should Canada have tracking devices to monitor the quarantine? And finding companionship during the COVID-19 crisis.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with the strain on small businesses during this pandemic. According to the Canadian Federation of Independent Businesses, 80% of small companies are completely or partially closed in order to stop the spread of COVID-19. Rent is the second highest cost after wages for those entrepreneurs. But with little to no money coming in, it's getting harder for them to pay their bills. Today, the Prime Minister said he's aware of the issue, but warned opening things up too soon could come at a greater cost. Mike Drolet reports.
We are being very, very careful in how we move forward as a country.
There was no gray area in Justin Trudeau's daily address. Canada is not ready to reopen. The border, despite comments from Donald Trump hinting restrictions could ease sooner than later, is closed and will remain so until COVID-19 is under control.
If we reopen too quickly or too soon or in the wrong way, we could find ourselves back in this situation a couple of months from now, and everything we will have sacrificed during these months will have been for naught.
Facing increased pressure to jumpstart the economy, Trudeau announced $306 million in interest-free loans and non-repayable contributions to help keep Indigenous businesses afloat. It comes after Ottawa announced it was looking into a program to help small and medium-sized businesses pay their rent. Relief can't come soon enough for Do It Right Fitness for Women in Whitby, Ontario, whose owners stopped taking membership dues when they were forced to close, yet are still paying $5,300 a month rent, money that is coming out of their savings.
Probably another few months. If we're having to continue to pay rent full, we won't be able to last through June, July, the summer. We'll be closed.
The program puts the onus on landlords to give imperiled businesses a lifeline, which not all are doing. This Danforth restaurant is now closed. A sign on the door reads, "The landlord has taken possession of this store for non-payment of rent," and more could be coming. A survey by the Canadian Federation of Independent Businesses found that 22% of its members had zero income coming in, while half say they won't survive another month.
What I'm nervous about is just digging myself a hole that I'm not able to get us out of.
The provinces have jurisdiction over rent and the relationship between landlords and tenants. But Trudeau says he's had recent meetings with industry groups and provincial leaders to see if a solution can be found. With rent due in less than 2 weeks, the clock is ticking. Mike Drolet, Global News, Toronto.
Many of the cases in Canada have come from those returning from the U.S. It has more confirmed cases and deaths from COVID-19 than any other country in the world. More than 730,000 Americans have tested positive for the virus. At least 38,000 have died. Despite the worsening situation, many Americans are desperate to get back to normal life. And as Jennifer Johnson explains, today hundreds of them took to the streets.
Protesters circling the state capitol and governor's mansion in Annapolis, Maryland. Joining a growing chorus of angry Americans desperate to get back to work. But in hard-hit New York, this governor, like many others, is torn between protecting his citizens and protecting his economy.
Nobody wants to reopen more than me. Nobody wants to get the economy going more than me.
Stay-at-home orders vary from state to state. A couple of governors will lift theirs as early as Monday.
Texas and Vermont will allow certain businesses to open on Monday while still requiring appropriate social distancing.
Health officials warning there may be enough COVID-19 tests for the beginning phase of President Donald Trump's three-part plan to reopen businesses and restore the economy, but not beyond that.
If these things are done correctly, what I believe they can, we will have and there will be enough tests to allow us to take this country safely through phase one.
A risky move as many states are still seeing a rise in cases. Nursing homes are being overrun. So many healthcare workers and patients getting sick, the National Guard has been called in to help. Nearly half of the centers are reporting staffing shortages.
We need the protective gear that we should have to take care of these residents. We have children, we have our own family to go home to.
The economic toll from COVID-19 is also harming millions. Food banks are running out of supplies. The U.S. Department of Agriculture is now rolling out a $19 billion relief program, buying food from farmers and getting it to food banks.
This program means that we get to eat today.
The nation's food supply is dwindling as meat, poultry, and pork processing plants have shut down in South Dakota, Iowa, Colorado, and other states because so many workers have been infected. Annie Grant died of the virus after working at this Georgia food processing plant. She had been on the packing line for nearly 15 years.
She said, baby, they're telling us if we don't come, we don't get paid or we risk getting fired. And she had to go.
The threat of the virus versus the threat of being unemployed.
Bills are piling up.
America caught in the crosshairs of a pandemic and an economic crisis, and no immediate cure for either. Jennifer Johnson, Global News, Washington.
Let's look at the picture across Canada now. More than 1,400 people have died from COVID-19. Confirmed cases have now surpassed 33,000. More than 500,000 tests have been done, with 6% of them coming back as confirmed cases.
Dr. Tam said that there is some cause for cautious optimism coming from the data. This still holds true. But we must remain vigilant, stay focused, and keep our eyes on the ultimate goal, which is limiting the spread of this terrible virus.
Most of the deaths in Canada are in Quebec, inside long-term care homes. Quebec's premier has described the situation as a national emergency. And tonight, the province is receiving help from the federal government. As Dan Spector explains, members of the Canadian Armed Forces are now coming to the rescue.
A surreal but welcome sight. Members of the Canadian Armed Forces are now deployed to a public long-term care residence in Montreal.
People were clapping. Listen, this situation is so dire that people need help.
Lieutenant Commander Heather Galbraith is one of 100 Canadian Forces medical personnel fanning out to Quebec seniors' homes. She's a trained family doctor who grew up in Sudbury, Ontario.
We are essentially doing what we call in the Army and Navy and Air Force a recce, so a reconnaissance of what needs are required.
This is the second seniors' home the forces assessed. The Centre d'Hébergement Yvon Brunet has 105 cases of COVID-19, more than half its residents.
Even if it's the Army or doctors or anybody, I'm happy there's some help there.
We have training packages that are being rolled out. A lot of that will be learned on the job as well.
So far, the forces are focusing on 5 residences in Montreal, but the needs are widespread.
Malheureusement, on a plusieurs d'entre eux qui sont malades.
Unfortunately, many of our staff are sick. They have COVID-19, says this health official. Crews in long-term care facilities can't keep up with demand to deal with some basic needs of seniors, like feeding and changing diapers. Canadian soldiers are stepping up.
Absolutely. Our teams will do whatever we can.
And there's another type of reinforcements on the way to Montreal's seniors' residences, specifically those in the western portion of the island.
We're training our new staff, volunteers, and other people, anyone that volunteered really.
Health authorities in Montreal's West Island have partnered with the Red Cross to give volunteers crash courses to help out in seniors' homes.
Power of humanity that we usually send outside of Canada to countries that are really in deep need. Now we are bringing it home.
They have the capacity to train 40 people a day. Part of this hotel has become a makeshift training center. Officials hope lots of people will turn out because the battle is far from over. Dan Spector, Global News, Montreal.
Concerns at an Alberta long-term care home have prompted the province's health authority to take over its operations. Alberta Health Services is now managing Manoir du Lac, a care home about 4 hours northwest of Edmonton. At least 26 residents and 11 staff have tested positive for COVID-19. 5 residents have died. Alberta's Chief Medical Officer of Health says the province took over because of several concerns, including inadequate screening, a lack of staff, and failure to meet care standards. Family members with loved ones in the home were surprised to learn about the problems.
It's not a good situation, to be honest, and now a lot of the other staff are in jeopardy, and the residents especially, and hopefully things get taken care of.
The company that was managing the care home says it was following protocols to the best of its ability. Meanwhile, Ontario reiterated it has no intention of taking over care homes that have COVID-19 outbreaks. Instead, the province is coordinating plans with the facilities. With every announcement about changes to the financial programs rolled out in Ottawa, we hear about thousands of Canadians who are left out. Abigail Bimman tells us about the changes some people are calling for and why help is so badly needed, especially among the nation's most vulnerable.
Walter Cole was already homeless. Then he lost his job as a cleaner due to COVID-19.
I'd like to go back to work.
Life for him at the Ottawa Mission Shelter has changed. New rules around cleaning and trying to enforce physical distancing, not easy among the homeless. Cole is not worried about getting sick.
Not one bit, because you know why? All 3 shelters, nobody's got it. This place is so clean.
But fear keeps staff on high alert.
Every call it's, is this the one? Is this the first positive test? Because we know we're in an enclosed environment and what a risk that would bring.
Peter Tilley says some of the $200 million promised by the federal government for the homeless has trickled down to his shelter, but more is needed. And the homeless are just one vulnerable population.
We're hooped. It doesn't matter which way you look at it. We are absolutely hooped.
Sue Beattie was laid off due to COVID-19, so she would be eligible for the CERB. But like thousands of Canadians, she's worried if she applies, she'll lose her provincial disability benefit. BC was the first province to be clear it wouldn't do that.
It's so wrong on every single level. It seems everybody except the vulnerable are being looked after. And it really should be the other way around, or at least equal.
You could well see a dollar-for-dollar clawback. So you could apply for CERB and then realize at the end of the month that your disability payment you thought was going to be $1,000, $1,500 is now zero because you applied for the emergency benefit.
The Canadian Centre for Policy Alternatives has been tracking who falls through the cracks. Even with this week's expansion of the program, Dave McDonald says there are about 800,000 Canadians who can't get the CERB or EI. And he says youth were hit especially hard.
A third of all youth that were employed in February either lost their job or lost the majority of their hours in March.
Shaylin Harnish is behind this petition to expand the CERB to include students and new graduates. The single mom and full-time student has no idea whether she can afford to go back to the classroom this fall.
We feel left behind and we're looking for support. If we could work, we'd rather work, but we can't.
With millions of Canadians feeling the same way. Abigail Bimman, Global News, Ottawa.
Coming up, what one famous city in Italy looks like now compared to a year ago. The world is watching just how fast COVID-19 is spreading around the globe. Tonight, there are more than 2.2 million cases of COVID-19 globally, and more than 157,000 people have died. The United States has the most deaths of any country. More than 38,000 people have died there. In Italy, 23,000 people are dead, the second highest death toll of any country. And in Spain, more than 20,000 people have died from COVID-19. Hopes the UK was beginning to see its deadly curve flattening out have been dashed after recording its 4th worst daily death toll since the pandemic began. More than 800 people died in the UK in the last 24 hours, and that brings the total number of deaths connected to COVID-19 to more than 15,000. Because of Britain's crisis, Queen Elizabeth has cancelled the royal gun salutes to mark her birthday. The monarch turns 94 Tuesday, and there will be no celebration. This will be the first time in the Queen's 68-year reign that the royal tradition has been called off. Two photos shot from space a year apart show the impact Italy's nationwide lockdown has had on waterways in Venice. The European Space Agency released this image of what a famous lagoon looked like just over a year ago, normally packed with tourists, cruise ships, and people out enjoying the sea breeze. But a year later, and since the lockdown went into effect on March 20th, there's been a huge reduction in boat traffic and no doubt pollution. Still ahead, the tracking device that is being tested to make sure people aren't breaking quarantine. China has again revised the death toll from COVID-19, and it went up again. China says nearly 1,300 people were not counted as victims of the deadly virus because of lapses and delays. China's death toll now stands at more than 4,600 people. Health experts had feared China was underreporting cases of COVID-19, but Beijing claims there is no cover-up. An experiment with a Canadian connection is taking place in Hong Kong. Residents and visitors arriving at the airport are being given monitoring bracelets to make sure they're staying in quarantine. A Vancouver company is behind the surveillance devices, but there's also a legal test, pitting privacy against public health. Hong Kong was one of the early hotspots for the new coronavirus. That government immediately implemented quarantine measures for residents and visitors arriving at the airport. That included these monitoring bracelets to stop people from leaving their homes.
As soon as you get out of the house, and then the government would get alert, and then the healthcare or the police would come catch you, and then it would be up to 6 months imprisonment.
The wristbands are like hospital bracelets. Each one has a Bluetooth module and battery. Those under quarantine have to download the app. Once at home, they walk around so the app can calibrate how big the home is with the wristband.
So this could be someone's at Customs and Border Patrol or a health authority.
A Vancouver company, TraceSafe, is behind the technology, and the Chinese territory is its first test case.
There's a thin piece of metal that goes all the way around the bracelet that actually provides an alert if it's cut or stretched. So there are tamper-resistant pieces to the design.
CEO Wayne Lloyd is pitching the devices to other governments, including Canada. But in this country, it would have to pass a constitutional test that balances privacy rights with public health.
To put bracelets on people under any circumstances would require that a law be passed in Parliament. I do not believe that the emergency management powers allow either federal or provincial legislatures to do that right now.
Hong Kong supposedly had 20,000 bracelets ready at airport arrivals, but not everyone received one.
I think one big problem is that they really didn't have a chance to test run the whole system before it goes out.
TraceSafe is working out the kinks, so to speak, but feels this is the way to get out of lockdown faster.
Once the tracking is over, you cut the bracelet off and it's done. This is not a sort of behind your back Big Brother sort of thing.
Still, the concern over Big Brother may explain why Canada is relying on the conscience of Canadians to prevent community spread of this silent killer. Doctors in Japan are warning that the country's medical system could collapse amid a wave of new COVID-19 cases. Japan initially appeared to have the virus under control, but now there are more than 10,000 confirmed cases of COVID-19 in the country. Health officials say emergency rooms have been unable to treat some patients with serious health conditions because of the extra burden caused by the virus. Pandemic pets, how our time staying home is helping more animals find homes. That's next. We've all been spending a lot more time at home this past month, seeing our friends on screens instead of in person. Animal shelters are seeing a huge increase in the number of people looking to adopt or foster a pet to deal with the loneliness from COVID-19. Here's Reggie Cicchini.
The need to find these animals a forever home has run up against a world stuck at home as the COVID-19 pandemic leaves shelters struggling to keep their doors open.
If a staff person goes down with COVID, then what does that mean for the team that they've got in place to deal with the frontline care inside the shelter?
To ease the burden, a call was put out asking people to open their hearts and their homes.
In southwestern Ontario, Lincoln County Humane Society, they put out their normal call for, usually get about 20 fosters. 400 people responded.
In Canada, foster rates are 40 to 70% higher now than the same time last year, and it's a story that's playing out across the continent.
We've seen the biggest uptick in people that want to foster animals during the time when they're working from home.
You're such a good boy, buddy.
In times of high stress, a four-legged friend can provide a much-needed distraction and have a way of keeping us grounded.
And the fact that pets really live in the moment sort of reinforces that that's what we should be doing right now.
Studies have shown that pets have a positive impact on our health, helping to decrease blood pressure, lower cholesterol, and reduce loneliness. But the furry friends families are bringing into their homes are also experiencing something themselves.
Animals are highly sensitive, which is what makes them such great companions. And so if you have a high amount of stress in your life right now, your animal's probably sensing it.
Amidst a health crisis comes a learning opportunity for families and their foster pets to explore each other's surroundings and feelings.
This crisis is demonstrating to us just how important our animals are. You know, you see all kinds of hashtags coming up about new co-workers and working at home with pets.
Once again, proving pets can provide unconditional love.
We definitely see the strength of the human-animal bond.
No matter how uncertain the times. Reggie Cicchini, Global News, Washington.
We've seen an outpouring of support for healthcare workers who are on the front lines of this pandemic fight. Tonight, there will be another demonstration of that gratitude, a virtual concert right here on Global and airing around the world. It's called One World Together at Home. It's not a telethon. The tab has been picked up by philanthropists, the corporate sector, broadcasters, and entertainers. The show is being curated by Lady Gaga, who will also perform. Other stars include Elton John, Billie Eilish, Taylor Swift, and the Rolling Stones. The 2-hour broadcast of One World Together at Home airs on Global TV tonight. You can check your local listings for times. And that is Global National for this Saturday. I'm Robin Gill. One of the Canadians taking part in that fundraiser is Rufus Wainwright, but it's not the only show the Montreal-born musician has in store. It's day 33 for Quarantunes, Wainwright's daily robe recitals streamed from his living room. Thank you for watching. Good night.
For